Welcome to the Imprint Hub, where we talk about maternal and pediatric pharmacology. Today, we're talking about a really fantastic tool created by the Imprint team at Vanderbilt called Peds-Phecodes, which is designed to turn large amounts of electronic health records data into phenotypes that can be used for pediatric health and pharmacology research. Here to talk about it, we are joined by one of the key creators of Peds-Phecodes from Vanderbilt, Monika Grabowska.
Hi, Emily.
Hi. Let's start by kind of backing up a little bit. And can you talk just in general about what context somebody might want to use fee codes? Because the just general fee codes is the basis of the PEDS fee code. So can you kind of start with under what circumstances would somebody want to use these?
Absolutely. So the original phe codes were developed largely to enable this idea of a phenome-wide association study, which is often regarded as the reverse of a genome-wide association study. So in a GWAS, the genome-wide association study, you start with kind of patients who have a disease or who don't have a disease, and then you look at what genetic variants are more common among those patients with disease compared to not. But in a PheWAS, actually, you're starting with a specific variant, but it could also be kind of a lab value, another phenotype, and then looking now not what genetic variants are associated with that predictor, but what phenotypes, broadly speaking, are associated. So what diseases or conditions are associated with whatever predictor you have. But in order to enable that, some restructuring of the way that current ICD codes are recorded in electronic health systems was needed. Typically, patients receive diagnosis codes in the form of ICD-10 or ICD-9 codes within their electronic health record, but those codes are highly diverse, they're very granular, and they can't easily be bucketed into clinically meaningful phenotypes. So the original idea behind the phe codes was how can we condense this thousands and thousands of ICD-9-CM and ICD-10-CM code space into more concrete, clinically meaningful phenotypes that can then help us do this phenome-wide association study and see easily, which phenotypes are associated with a genetic variant or other predictor. And if you look through just the browser, you can see kind of the very different ICD codes that at times map to a particular phe code, which you wouldn't just get by looking at kind of all ancestors within a certain ICD kind of chapter or something like that. So it's a little bit more nuanced and really looking at how can we use the ICD codes and aggregate them in meaningful ways to reveal what diseases patients have.
So is there a specific example that you can give us?
Yeah. If you can see here, this is what I showed before with the web browser for the pediatric phe codes specifically. But if you look at, been using 714 in my tutorial, which again is the rheumatoid arthritis kind of parent phe code, but you can see here just the heterogeneity of ICD-10-CM codes, ICD-9-CM codes that map to this one phe code, which includes kind of this M12, 714, but also kind of 22 pages of phe codes that can be quite different, including these SNOMED CT codes as well now.
Yeah, so if you were trying to do this type of research just using the ICD codes, you could be working on it forever rather than just having this one fee code.
Yes, exactly. So it's a way of kind of having a standardized ICD code representation of a particular phe code as well, which has already been validated in kind of previous phenome-wide association studies.
So the PEDS fee codes are based off of this.
Yes.
Can you kind of explain what you see as like the biggest differences between the PEDS fee codes and the original fee codes?
Yes. So the biggest difference, I would say, is actually the granularity with which the phe codes are able to capture some of the phenotypes that are kind of, I would say, specific or more common among pediatric populations. So the way that we developed the phe codes involved looking at the prevalence of each phenotype within electronic health records, data from Vanderbilt University Medical Center, and looking at, okay, is this a condition that's more common in adults or children? If it's more common in children, can we actually detect some more granular phenotypes within that could then be useful? And I can give an example as well. So with the phe codes, the original version, there was kind of one large bucket for chromosomal abnormalities that only had maybe kind of one or two sub phe codes, but really we built that up in the pediatric phe codes to reflect specific chromosomal abnormalities like Turner syndrome, Prader-Willi, other things that could be informative when trying to phenotype those patients specifically. So really capturing a lot more granular signals and kind of we reformatted some of the phe codes as well in terms of the disease categories. So kind of cleaning it up and making kind of congenital diseases a specific kind of disease category and just kind of reformatting how they kind of even looked like in a PheWAS.
If you kind of imagine, like, how is somebody going to approach this from like idea to outcome? What does that process look like?
Absolutely. So I think the idea is largely to kind of be analogous to using the original phe codes, which are typically used kind of in PheWAS instances, like I showed in the tutorial. But the idea is if you have a pediatric population specifically that you're interested in phenotyping, so kind of condensing all of the ICD codes that you have for them from the electronic health record into these more meaningful kind of clinical disease buckets. And then you can either kind of stop there and do what you want with that, but really our ultimate purpose, and that's why we built the Peds-Phecodes package, is to then move from those phenotypes to see, can we examine whether specific genetic variants are associated with one of those phenotypes, are certain lab values associated with one of those phenotypes, or certain imaging tests. So you can really kind of do whatever you want. I think the idea is really that you have some sort of diagnosis codes, usually in the form of ICD-9-CM, ICD-10-CM, and now the SNOMED CT codes as well. Have those for a pediatric population are really interested at looking at either kind of genotype phenotype associations or any other type of large scale kind of omics associations, usually, but really any.
So my last question would be, do you see these as being like fixed, or is this something that gets revised over time?
This is definitely something that gets revised over time, and we've definitely in the past kind of really appreciated when people have kind of picked up specific instances and been like, I would suggest a different mapping for this particular phe code, again, because of how they were done in a largely kind of data-driven way with some kind of expert insights for the kind of phe codes that we at least detected as perhaps needing more kind of attention. But that's not perfect. So we do appreciate when people who are experts in a particular phenotype can give us suggestions for how we can improve a mapping, and we do try to accommodate those and really appreciate getting them. I think in the future, we're really thinking about, how can we automate this in a sense? Would that be automatically based on, when we move potentially to ICD-11, how will we kind of reflect those new codes in there as well? I think we're excited about the potential of large language models and kind of AI as well, which is something that an idea we've tossed around in the lab, but we don't really know how exactly that'll manifest. But the idea is we're looking to kind of automate this in a sense, and we're still kind of figuring out how to do that.
Awesome. Thank you so much for joining us, Monika, and thanks to you, our audience, for being here. Monika has also created a tutorial about how to use Peds-Phecodes that will be available on our website, so be sure to check that out if you're interested. And if there are any other topics that you'd love to see us discuss, please let us know in the comments below, and we'll see you next time.